Question. What is the scientific study of bones called? Answer. Osteology. Next question. What are the two main types of bone tissue? Answer. Compact, cortical, bone and spongy, cancellous, bone. Next question. What is the dense, hard outer layer of a bone called? Answer. Compact bone. Next question. What is the lightweight, porous inner layer of a bone that contains bone marrow? Answer. Spongy or cancellous bone. Next question. What is the shaft of a long bone called? Answer. The diaphysis. Next question. What are the ends of a long bone called? Answer. The epiphyses. Next question. What is the region where the diaphysis and epiphysis meet in a growing bone? Answer. The metaphysis. Next question. What is the tough, fibrous membrane that covers the outer surface of bones? Answer. The periosteum. Next question. What is the thin membrane that lines the inner cavity of bones? Answer. The endosteum. Next question. What is the hollow, cylindrical space within the diaphysis called? Answer. The medullary cavity. Next question. What is the primary component of the inorganic matrix of bone that provides hardness? Answer. Hydroxyapatite, a calcium phosphate mineral. Next question. What are the bone cells responsible for forming new bone? Answer. Osteoblasts. Next question. What are the mature bone cells trapped within the bone matrix called? Answer. Osteocytes. Next question. What are the large bone cells that break down and resorb bone tissue? Answer. Osteoclasts. Next question. What is the process of bone formation called? Answer. Ossification or osteogenesis. Next question. What are the two main types of ossification? Answer. Intramembranous ossification and endochondral ossification. Next question. Which type of ossification is responsible for forming flat bones like the skull? Answer. Intermembranous ossification. Next question. Which type of ossification involves the replacement of a cartilage model with bone? Answer. Endochondral ossification. Next question. What is the area of cartilage in a long bone that is responsible for longitudinal growth? Answer. The epiphyseal plate or growth plate. Next question. What is the term for a rounded projection at the end of a bone that articulates with another bone? Answer. A condyle. Next question. How many bones are in the average adult human skeleton? Answer. 206. Next question. What are the two main divisions of the human skeleton? Answer. The axial skeleton and the appendicular skeleton. Next question. What part of the skeleton includes the skull, vertebral column, and rib cage? Answer. The axial skeleton. Next question. How many bones make up the cranium, skull excluding the jaw? Answer. 8. Next question. What is the name of the bone that forms the forehead? Answer. The frontal bone. Next question. What are the two bones that form the upper sides and roof of the cranium? Answer. The parietal bones. Next question. What bone forms the back and base of the skull? Answer. The occipital bone. Next question. What is the large opening at the base of the skull where the spinal cord connects to the brain? Answer. The foramen magnum. Next question. What is the U-shaped bone in the neck that supports the tongue? Answer. The hyoid bone. Next question. How many bones are in the vertebral column, spinal column? Answer: 26 in an adult. Next question. What are the 5 regions of the vertebral column from top to bottom? Answer: cervical, thoracic, lumbar, sacrum, coccyx. Next question. How many cervical vertebrae are there? Answer: 7. Next question. What is the first cervical vertebra called? Answer: the atlas, C1. Next question. What is the second cervical vertebra called? Answer: the axis, C2. Next question. How many thoracic vertebrae are there? Answer: 12. Next question. What is the structure that is formed by the fusion of 5 vertebrae and forms the back of the pelvis? Answer: the sacrum. Next question. What is the tailbone formed by the fusion of 4 small vertebrae? Answer: the coccyx. Next question. What are the fibrocartilage pads between the vertebrae called? Answer: intervertebral discs. Next question. How many pairs of ribs do humans have? Answer: 12 pairs. Next question. What are the first 7 pairs of ribs that attach directly to the sternum called? Answer: true ribs. Next question. What are ribs 8 to 10 which attach to the sternum via costal cartilage of the rib above called? Answer: false ribs. Next question. What are ribs 11 and 12 which have no anterior attachment called? Answer: floating ribs. Next question. What is the common name for the sternum? Answer: the breastbone. Next question. What are the 3 parts of the sternum? Answer: manubrium, body, and xiphoid process. Next question. What are the bones of the middle ear called? Answer: the malleus, incus, and stapes, ossicles. Next question. How many bones are in the human face? Answer: 14. Question. What is the upper jawbone called? Answer: the maxilla or maxillary bone. Next question. What is the lower jawbone called? Answer: the mandible. Next question. What are the cheekbones called? Answer: the zygomatic bones. Next question. What part of the skeleton includes the bones of the limbs, shoulders, and hips? Answer: the appendicular skeleton. Next question. What is the technical name for the collarbone? Answer: the clavicle. Next question. What is the technical name for the shoulder blade? Answer: the scapula. Next question. What is the bone in the upper arm? Answer: the humerus. Next question. What are the 2 bones in the forearm? Answer: the radius and ulna. Next question. Which forearm bone is on the thumb side? Answer: the radius. Next question. Which forearm bone is on the pinky side? Answer: the ulna. Next question. How many bones are in the wrist? Answer: 8. Next question. What are the wrist bones collectively called? Answer: the carpals. Next question. How many bones are in the palm of the hand? Answer: 5. Next question. What are the bones of the palm called? Answer: the metacarpals. Next question. How many phalanges are in each hand? Answer: 14, 3 in each finger, 2 in the thumb. Next question. What are the bones of the fingers and toes called? Answer: phalanges. Next question. What is the name of the hip bone? Answer: the os coxae or innominate bone. Next question. What are the three fused bones that make up each hip bone? Answer: the ilium, ischium, and pubis. Next question. What is the largest bone in the human body? Answer: the femur, thigh bone. Next question. What is the technical name for the kneecap? Answer: the patella. Next question. What is the bone in the thigh? Answer: the femur. Next question. What is the larger, weight-bearing bone of the lower leg? Answer: the tibia, shin bone. Next question. What is the smaller, lateral bone of the lower leg? Answer: the fibula. Next question. What is the anatomical term for the ankle bone? Answer: the talus. Next question. What is the bone of the heel called? Answer: the calcaneus. Next question. How many bones are in the ankle and upper foot? Answer: 7. Next question. What are the ankle bones collectively called? Answer: the tarsals. Next question. How many bones are in the sole of the foot? Answer: 5. Next question. What are the bones of the sole of the foot called? Answer: the metatarsals. Next question. How many phalanges are in each foot? Answer: 14. Next question. What is the name of the joint where the two pubic bones meet? Answer: the pubic symphysis. Next question. What is the bony protrusion you can feel when you sit down? Answer: the ischial tuberosity. Next question. What is the cavity in the hip bone where the head of the femur fits? Answer: the acetabulum. Next question. What is the soft tissue found within the medullary cavity of bones? Answer: bone marrow. Next question. What are the two types of bone marrow? Answer: red bone marrow and yellow bone marrow. Next question. What is the primary function of red bone marrow? Answer: hemopoiesis, the production of blood cells. Next question. What type of bone marrow is primarily composed of fat cells? Answer: yellow bone marrow. Next question. What blood cells are produced in the red bone marrow? Answer: red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes. Next question. In adults, which bones typically contain red bone marrow? Answer: the pelvis, sternum, vertebrae, ribs, and proximal epiphyses of the femur and humerus. Next question. What is the process of blood cell formation called? Answer: hemopoiesis or hematopoiesis. Next question. What is the name for the stem cell that gives rise to all blood cells? Answer: hematopoietic stem cell. Next question. What condition is characterized by a deficiency of red blood cells or hemoglobin? Answer: anemia. Next question. What cancer involves the overproduction of abnormal white blood cells in the bone marrow? Answer: leukemia. Next question. What is the point where two or more bones meet called? Answer: a joint or articulation. Next question. What are the three structural classifications of joints? Answer: fibrous, cartilaginous, and synovial. Next question. What type of joint is immovable and connected by fibrous tissue, like the sutures in the skull? Answer: a fibrous joint. Next question. What type of joint is slightly movable and connected by cartilage, like the pubic symphysis? Answer: a cartilaginous joint. Next question. What type of joint is freely movable and contains a joint cavity? Answer: a synovial joint. Next question. What is the fluid-filled space within a synovial joint called? Answer: the joint cavity. Next question. What is the name of the fluid that lubricates and nourishes a synovial joint? Answer: synovial fluid. Next question. What is the tough, fibrous tissue that connects bone to bone? Answer: a ligament. Next question. What is the flexible connective tissue that cushions the ends of bones at joints? Answer: articular cartilage. Next question. What is a sac filled with synovial fluid that reduces friction near a joint? Answer: a bursa, plural, bursae. Next question. What type of joint allows for movement in one plane, like the elbow? Answer: a hinge joint. Next question. What type of joint allows for rotational movement, like the atlas and axis vertebrae? Answer: a pivot joint. Next question. What type of joint allows for the greatest range of motion, like the shoulder and hip? Answer: a ball and socket joint. Next question. What is the inflammation of a joint called? Answer: arthritis. Next question. What is the degenerative wear and tear arthritis called? Answer: osteoarthritis. Next question. What is the autoimmune form of arthritis where the body attacks its own joints? Answer: rheumatoid arthritis. Next question. What is the condition caused by a buildup of uric acid crystals in a joint? Answer: gout. Next question. What is the term for the displacement of a bone from its joint? Answer: a dislocation. Next question. What is the term for the stretching or tearing of a ligament? Answer: a sprain. Next question. What is the medical term for a broken bone? Answer: a fracture. Next question. What is a fracture where the bone breaks but does not penetrate the skin? Answer: a closed or simple fracture. Next question. What is a fracture where the broken bone penetrates through the skin? Answer: an open or compound fracture. Next question. What is a fracture where the bone is broken into 3 or more pieces? Answer: a comminuted fracture. Next question. What is a fracture that occurs in a straight line across the bone? Answer: a transverse fracture. Next question. What is a fracture that occurs at an angle across the bone? Answer: an oblique fracture. Next question. What is a fracture where the bone is crushed? Answer: a compression fracture. Next question. What is an incomplete fracture common in children, where one side of the bone breaks and the other bends? Answer: a green stick fracture. Next question. What is the process of healing a fracture called? Answer: fracture repair or bone healing. Next question. What is the mass of blood that forms at a fracture site? Answer: a hematoma. Next question. What is the soft callus made of fibrocartilage that forms during fracture healing? Answer: a fibrocartilaginous callus. Next question. What is the hard callus made of bone that eventually replaces the soft callus? Answer: a bony callus. Next question. What is the term for the stretching or tearing of a muscle or tendon? Answer: a strain. Next question. What is the term for inflammation of a tendon? Answer: tendinitis. Next question. What is a stress fracture? Answer: a small crack in a bone caused by repetitive force or overuse. Next question. What is the medical term for a shin splint? Answer: medial tibial stress syndrome. Next question. What common injury involves the ligaments of the ankle? Answer: an ankle sprain.